Okay. So thank you so much, Doctor, for the information that you've given. So then next question, Doctor, to you is what are the risk factors for depression in elderly?
Yes, it's very important, Mr. Rogers, what you asked today. Depression has so many risk factors are there, but when you come to elderly, certain unique factors are there. Especially Indian population, you see, until 60 years, he will head of the family. He's the main earning member. Once 50 years, 60 years over, he retires. The position of the family will be displaced. It means somebody else will take over the head of the family, like son, no, or a daughter, or daughter-in-law, or somebody will take over the head of the family. See, the position change, the transition in the family dynamics, power dynamics, and also retirement. So you're going to office regularly for last 35 years, 30 years. You're working, you have certain group of friends there. You miss out all those friends after retirement. Okay. These are two factors. The other is sometimes you will feel demise of the friends, spouse, family members around you. You may start losing one by one. So this is one risk factors. The other is medical comorbidities. As we age, certainly the medical problems will increase. Diabetes, hypertension, osteoarthritis, hearing problems, vision problems, dental problems. So all these things do come up. So you have to accommodate a lot of things in life. So this becomes very strenuous, very stressful for a person. Especially modern day world, people in a fast-paced life, you have to accommodate so many restrictions. Like they can't walk the state, they can't walk too long, like that. So these are risk factors. So new onset medical conditions like Parkinson's disease, dementia. Okay, and these are contributing factors. Now there is polypharmacy, certain medication like steroids. Okay, an certain certain anti-cancer medication, anti-tubercular medication, all can increase the risk of depression elderly. So when we are looking at this, so many risk factors will prone to risk of depression. Some are psychological factors, some are social factors, some are medical factors, some are for medication factors. So all these things do increase the risk of depression. So when we are evaluating, we look at all those things, we try to address all those things. So, and these days, empty nest syndrome, like when the children grow up, they do the degrees, they do the jobs, and they migrate to abroad. So the empty nest, only the couple will be stayed together. In sort of metros and cities, there will be elderly couple, 70s staying together, and children will be living somewhere else in the world. And usually nobody visits them regularly. So the feeling of loneliness, longing, isolation will be bothering them a lot. So these things will put them at risk of depression. So వృద్ధుల్లో చాలా మటుకు ఏకాంతత, ఎవరు లేకపోవడం అనే బాధ, ఎవరు చూడడానికి రావట్లేదని బాధ, మెడికల్ ప్రాబ్లమ్స్, శరీర రుగ్మతులు, దాంతోపాటు మతిమరుపు, ఇవన్నీ కూడా వృద్ధుల్లో మానసిక బాధ, డిప్రెషన్ ని పెంచే విధంగా ఉంటాయి. వీటన్నిటిని మనం కొంతవరకు సరిచేస్తే డిప్రెషన్ రాకుండా మనం నివారించుకోవచ్చు.
Okay, thank you so much, Doctor. So, Doctor, my next question to you is what treatment options are available for depression in elderly?
Yeah, that's a very important again. So, when we evaluate depression or treat depression, it is not similar to young people. There are so many differences are there. As I mentioned, this is a very special population. So, their reserves of hepatic, renal are already compromised. So we should remember those things. They're very sensitive to medication also because their frail body will not tolerate a lot of medicines. So there are two kinds of therapies we do. One is medical treatment, one is psychological treatment. Psychological treatment we'll do for everybody. That is we call it as counseling or psychotherapy, where we address their own lifestyle, their sleep pattern, their stress level, addressing the social network to increase, promoting good lifestyle habits, along with correcting their own thinking process. The thinking could be everything will be well, but they think nothing is going right for them. So try to correct those thinking, try to regulate that emotions. Then a lot of people will be all right with that. But few people with a severe depression, they still require medical treatment. We prescribe antidepressants. So antidepressants, prescribing elderly is a kind of like meticulous job. Like we have to see what medication suits them, what medication they don't choose, what is their medical problems they have, what medication they are taking, what drug interactions they have. So then we have to manage it well so that they don't face another additional difficulties. With this medical treatment, they don't face additional difficulties. So we give SSRIs, SNRIs are antidepressants. At a very low dose, we start. We try to monitor, we try to increase gradually depending on the response. And most patients do well with antidepressants. And we monitor them regularly, every 15 days once in a month. We do monitor their sugar levels, their electrolytes, their ECG, their vitals. We'll check regularly. And most patients, when they don't think they have depression, but when we found they have depression, when we treat them, they're all right. We have seen people like 80-year-old, 90-year-old, 70-year-old suffering with depression for years. Well, we give treatment. They again started enjoying their life. They're going out. They're talking to their friends. They're restarting their hobbies again. And they extended their life until 5 to 6 years after that. Their quality of life has improved. And they're not no more bothering the relatives. They're no more bothering the own sons and daughters over phones. So they're pleasant and living happily. So certainly medications do help them along with psychotherapy. So everything has to be done in holistic management rather than only one particular thing in this. And there are so many other things like we can do like electroconvulsive therapy, brain stimulation. In very severe cases, we do have certain options where we admit them. We try to address these problems in a very scientific procedures. We use scientific ways to deal with these problems. Yes.
Thank you so much, Doctor, for the insights. So my last question to you, Doctor, before we conclude today's session, is how can caregivers and family members support an elderly person who is dealing with depression?
Yeah, that is also a very key area we often neglect, but it's very essential to talk about caretakers and caregivers also. The patient is important, certainly, but caregivers also important because their emotions will also impact the elderly also. So I prefer to be compassionate, bit of patience, bit of understanding them, bringing them at right time to the psychiatrist at early phase and supervised medication because elderly may have memory problems, may have hearing problems, they may forget to take medicines. So supervise the medicines little bit, bring them regularly and also encourage them physical activities at home. We give kind of task like taking them for 20-minute walk, 10-minute walk, gardening activities, certain involving in puja, spiritual activities, and involving the social network, the social function going on. Don't neglect. Take them also with you. You are going to shopping, take them along with you. So encourage them to involve them in activities. All these things do help them and the support. And they also feel that they're part of the family. They're also part of active involvement in the decision. So this should be taken care. And caregivers' emotions. Sometimes caregivers will be under very stressful jobs. There are a lot of things to handle. When you talk to them, try to solve their own emotional problems. They may take care of the elderly very well. Then this will solve a lot of other problems. So if you take only medical treatment, you don't address the caregiver stress, their own problems, then treatment may not go well. So you address simultaneously, talk to them. What is the issue? What is the problem? Difficulties handling them. Sometimes the caregiver may say that at night frequently we have to take them to toilet. It disturbs their sleep. So find a method for that to solve it. So find an easy way to solve it. So those things do help them. They also have a pleasant life. They also have a successful careers and they also can take care of the elderly very well. So these are the very important things. Nutrition is another thing. So sometimes they not eat well because of dental issues, because of the digestion issues. Manage easier, simpler diets, not a complex diet. So that also make them easier. And medication. When we see the patient, we see all the medicines, medical treatments, all treatments, all things. We try to simplify the regimen. Try to remove drugs which are not required, which are SOS medicines, which are mandatory medicines, how to simplify the regimen. You keep 3 times in a day, it's difficult to take 3 times. Keep it only once in a day or twice in a day, it becomes much easier to take. So we try to give that kind of suggestions and try to reduce the medication burden. Not only financially, but taking itself is also very difficult for the person to take so many tablets. So we try to do all these things with caregivers. So this could be about the caregivers issues. Just I want to add a few more things if you permit me to tell. So why we should identify depression and treat is that depression is a risk factors for dementia. So it will lead to dementia if you don't treat at right time. It's a risk factor. Depression is a risk factor for suicide. So a lot of elderly do commit suicide. It may come to notice, but a lot of people think, contemplate, and also act on the suicide thoughts. The other is depression may increase the risk of medical problems. We see patients who are given depression, they have high risk of heart attacks, high risk of brain strokes, high risk of falls. So by treating depression adequately, we can prevent all these things and we can address it very early phase. So it is a more complex than what we think in elderly. So depression obviously one of the important life limiting factor and also important factor for reducing quality of life. సో వృద్ధుల్లో డిప్రెషన్ మనోవేదన చాలా మందికి ఉంటుందండి. మనం గుర్తించాం సరిగా, వాళ్ళని గుర్తించి ట్రీట్మెంట్ ఇచ్చినట్టయితే వాళ్ళ లైఫ్ స్పాన్ ఇంక్రీజ్ చేయొచ్చు, వాళ్ళకి మతిమరుపు రాకుండా చేయొచ్చు, వాళ్ళ మెడికల్ ప్రాబ్లమ్స్ తగ్గించవచ్చు కొంతవరకు. సో వచ్చేస్ ఐఎమ్ ఓకే విత్ దట్.
So thank you so much, doctor. Those were all the questions I had for you today. I hope everybody who's listening finds this conversation very helpful. But before we conclude our session, doctor, is there any more final words that you would like to give to our audience?
Yeah, I think that depression elderly is neglected. We should not neglect it. We should come forward. If somebody says, I want to die, I wish everything, it should be seen as depression. There should be a holistic management, detailed assessment is involved, not just medicines. There is much more you can do. So early identification treatment is a must for them. సో వృద్ధుల్లో త్వరగా గుర్తించి డిప్రెషన్ ని ట్రీట్మెంట్ ఇప్పించినట్టయితే మెరుగైన ఫలితాలు ఉంటాయి. వాళ్ళు మనలాగే 60 ఏళ్ళ తర్వాత కూడా పని చేయవచ్చు, వాళ్ళు కూడా లైఫ్ ఎంజాయ్ చేయవచ్చు. చాలా వరకు మెడికల్ ప్రాబ్లమ్స్, మతిమరుపు వచ్చే భాగాన్ని మనం తగ్గించవచ్చు డిప్రెషన్ ని ట్రీట్ చేయడం వల్ల. డిప్రెషన్ కి చాలా వరకు సైంటిఫిక్ పద్ధతుల్లో ట్రీట్మెంట్ ఇప్పించినట్టయితే వాళ్ళ రికవరీ రేట్ చాలా బాగా ఉంటుంది. కాబట్టి డిప్రెషన్ నెగ్లెక్ట్ చేయొద్దండి. మీ వృద్ధుల్లో మీ పేరెంట్స్ లో ఉండొచ్చు, మీ గ్రాండ్ పేరెంట్స్ లో ఉండొచ్చు, లేదా మీరే సీనియర్ అయి ఉండొచ్చు. సో ఈ సైన్స్ గుర్తుపెట్టుకొని మీరు వచ్చినట్టయితే ట్రీట్మెంట్కి ఎక్కడైనా పర్లేదు, ఒక థెరప్యూటిక్ గా మీరు వెళ్ళినట్టయితే త్వరగా మీకు బెనిఫిట్స్ వస్తాయి. సో చాలా నిద్ర లేక స్లీపింగ్ పిల్స్ వాడుతూ ఉంటారు. చాలా మందిలో డిప్రెషన్ ఉంటుంది. ఈ స్లీపింగ్ పిల్స్ వాడడం వల్ల ఈ జబ్బు పెరుగుతుందే తప్ప తగ్గదు. సో కాబట్టి సరైన పద్ధతుల్లో ట్రీట్మెంట్ తీసుకున్నట్టయితే మెరుగైన ఫలితాలు వస్తాయి. థ్యాంక్ యూ.
Okay. Thank you so much, doctor. Thank you so much for your time. Thank you so much for being here with us today.
Thank you, Ajay. Sorry for my cough. Thank you. Thank you very much.
Thank you so much, doctor.